Welcome back to Dr. Gilbert, Healthy Aging. I am Dr. Gilbert. Throughout my extensive, decades-long active career as a clinical physician, neurological researcher, and practicing general surgeon who has repaired the torn rotator cuffs, inflamed bursae, and rigid thoracic spines of thousands of older adults, I have stood at the bedsides of proud, independent individuals and listened to the tragic postmortems of their mobility. When you spend your entire life working inside emergency surgical suites and orthopedic rehab bays, analyzing the exact anatomical and mechanical root causes of severe upper body restriction, your clinical perspective shifts. You stop looking at shoulder stiffness, sharp upper back pain, and the inability to reach into top kitchen cabinets as inevitable, harmless consequences of getting old. Instead, you begin to track the exact mechanical trap taking place inside your upper torso that precedes a total loss of daily independence. You realize a deeply unsettling truth. The primary threat to your shoulder function and posture after age 70 does not originate in an irreversible bone breakdown. It develops silently inside your shoulder socket every time you reach overhead with a rounded thoracic spine. And today, we are going to shine an uncompromising, highly precise medical spotlight on a silent, slow-motion upper body disaster taking place inside the homes of millions of aging Americans. It is a profound structural breakdown that I refer to in my clinical practice as the thoracic kyphosis and subacromial impingement loop. It is a hidden mechanical trap that pins your shoulder blade forward, narrows your joint space, crushes your rotator cuff tendons, and leaves your upper back frozen in constant, burning aches after age 70. Let us sit down together and have a completely raw, honest, clinical conversation about an unspoken, heavy anxiety that millions of you face in absolute solitude every single day. Have you noticed that when you try to reach up to grab a coffee mug or cereal box from a top cabinet shelf, a sharp, stabbing catch bites deep into the front or side of your shoulder joint? Do you find that when you try to reach behind your back to tuck in a shirt or fasten a seatbelt, your arm feels locked, sending a dull, deep ache up into your neck and across your upper back shoulder blades? Have you noticed that when you look at your profile in the mirror, your head protrudes forward, your shoulders roll inward, and your upper back forms a persistent, rounded hump that never seems to relax? If you recognized your own daily physical symptoms in that description, I want you to focus your mind and listen to the sound of my baritone voice with absolute, undivided attention today. You are unknowingly caught inside an escalating mechanical crisis. The standard Western habit of spending hours slouched forward over phones, tablet screens, or soft armchairs is systematically freezing the upper joints connecting your ribs, spine, and shoulder blades. You are not just getting stiff, you are allowing your pectoral muscles to shrink, your scapular stabilizers to shut down, and your shoulder joint clearance to drop to near zero. In the mainstream world of modern primary care medicine, I see physicians make a fatal diagnostic error every single day. When a senior over 70 reports severe shoulder pain or upper back tightness, they are treated with passive laziness. They are given heavy prescriptions for anti-inflammatory pain pills or cortisone injections that temporarily numb the joint while leaving the underlying mechanical impingement completely unaddressed. But as a general surgeon, it is my professional duty to look you directly in the eye and share the raw, unfiltered clinical truth. Injections and pills do not open a collapsed subacromial joint space or restore mobility to a frozen thoracic spine. Cortisone simply masks the pain signal while your arm bone continues to grind against your shoulder roof, accelerating tendon tears. If your shoulder blade remains trapped in a forward-slouched tilt, every overhead reach continues to pinch soft tissue, keeping your upper back muscles trapped in a state of continuous, agonizing spasm. I did not create this masterclass to leave you sitting in discouragement or fear. Fear is a paralyzing, useless emotion in your longevity journey. Quite the opposite. Today, I am going to hand you an absolute, scientifically validated mechanical shield of safety. In this episode, I am going to reveal the 10-second Doorframe habit for frozen shoulders and upper back pain, 70 plus. A simple, safe, and highly effective movement protocol using any standard doorway in your home to instantly decompress your subacromial space, glides your shoulder blade backward, and unfreeze your upper back without lifting heavy weights or risking injury. If you are truly ready to eliminate overhead shoulder catches, permanently release that burning knot between your shoulder blades, and experience the smooth, effortless arm mobility of your youth, turn off all distractions right now, focus your mind, and let us break down this deep anatomical knowledge together. Before we unlock the elegant neurological and biomechanical engineering behind the Doorframe method, take a brief moment to click that subscribe button and turn on the notification bell. By doing so, you join our global healthy aging family and ensure you are always equipped with real clinical truths to protect your independent freedom. Now, let us uncover the hidden anatomical breakdown that occurs inside your shoulder joints and spine whenever you live with forward-rounded posture after 70. Chapter 2. The Anatomy of Subacromial Impingement and Scapular Freezing. To permanently eliminate shoulder pain, release upper back tightness, and understand why reaching overhead without fixing your posture is mechanically destructive, we must analyze the upper body skeletal system through the strict, unyielding laws of joint clearance, leverage arcs, and scapulo-thoracic rhythm. Your shoulder is not a rigid ball and socket joint like your hip. It is a delicate, floating structural assembly designed for maximum range of motion. The head of your arm bone, the humerus, rests against a shallow socket on your shoulder blade, the scapula. Arching directly over the top of this joint is a bony shelf called the acromion. The narrow anatomical corridor lying between the head of your arm bone and this bony shelf is known as the subacromial space. Running directly through this narrow corridor is one of the most critical tendons in the human body, the supraspinatus tendon, the primary stabilizer of your rotator cuff, alongside a fluid-filled protective sac called the subacromial bursa. When you are young and posture is upright, your subacromial space measures approximately 9 to 10 millimeters in width, plenty of clearance for your arm bone to rotate smoothly beneath the bony shelf when you reach overhead. However, as we pass the major biological milestone of age 70, a devastating triple mechanical breakdown occurs inside this upper body assembly, driven directly by forward-slouched seating. 1. Forward scapular tilting and corridor narrowing. When your upper back rounds forward into thoracic kyphosis, your shoulder blades slide forward and tilt downward across your rib cage. This forward tilt drops the acromion bone down by several millimeters, physically crushing the subacromial space from 10 millimeters down to less than 3 millimeters. Your anatomical corridor is effectively locked shut. 2. Rotator cuff tendon impingement and bursitis. Because your subacromial space is crushed, the exact microsecond you raise your arm past shoulder height, the head of your arm bone acts like a mechanical lever, driving the supraspinatus tendon and bursa directly against the hard underside of the acromion bone. This continuous pinching produces acute friction, causing severe tissue inflammation, micro-tearing, and agonizing sharp catches of pain. 3. Upper back muscle exhaustion and ischemic knots. To keep your heavy, forward-slouched head and shoulders from collapsing completely, the large stabilizing muscles of your upper back, the rhomboids and middle trapezius, are forced into a state of continuous, isometric overwork. Held in a stretched, exhausted state 24 hours a day, these muscles develop dense, oxygen-starved, painful muscle knots, trigger points, that radiate constant, burning aches across your upper back and up into your neck. Look at the terrifying mechanical trap this creates inside your upper torso. A collapsed subacromial corridor pinching your rotator cuff, a forward-tilted shoulder blade grinding against your arm bone, and exhausted upper back muscles locked in painful spasms. To break this cycle, we must utilize a time-tested orthopedic technique that uses the mechanical structure of a standard door frame to reset your shoulder blade, open your joint space, and decompress your upper spine in seconds. Chapter 3. The Neurobiomechanics of the Doorframe Shoulder Reset. Let us now move away from structural pathology and focus 100% of our clinical energy on the concrete, life-saving solution, the 10-second doorframe habit, known in advanced orthopedic physical therapy and kinesiotherapy as the Doorframe Scapular-Thoracic Decompression Matrix. When older adults experience shoulder stiffness or upper back pain, the universal advice they receive is, just pull your arm behind your back or do heavy arm circles. As a surgeon who has operated on shoulder joints, I must tell you that pulling a stiff arm behind a forward-slouched torso is an anatomical disaster. Forcing your arm behind your back while your shoulder blade is tilted forward jams the head of your arm bone straight into the front joint capsule, accelerating tendon wear and worsening your pain. We must do the exact opposite. We must keep your spine tall, fix your forearm against a firm doorframe anchor, and use a subtle forward step to manually tilt your shoulder blade backward, opening your subacromial space and stretching tight chest muscles, pectoralis minor, without applying destructive rotational force to your joint. Let us execute this therapeutic masterclass together right now. You can perform this at any standard doorframe in your home. Follow me through the 4 precise sequential steps of this mechanical reset. Step 1. The forearm doorframe anchor. Neutral shoulder setting. 1. Stand directly inside an open doorway in your home. 2. Raise your right arm to the side, bending your elbow at a sharp $90 circ angle, so your forearm points straight up toward the ceiling. 3. Place your right forearm and palm flat against the outer frame of the doorway. Adjust your hand height so your elbow sits slightly below shoulder height, at approximately $80 of elevation. Keeping the elbow below shoulder height completely protects your rotator cuff during the setup. 4. Stand tall with both feet spaced shoulder width apart, looking directly straight ahead at eye level. Step 2. The anterior step-through. Scapular retraction and chest decompression. Keep your right forearm securely anchored flat against the doorframe. 2. Take a quiet, gentle breath in through your nose, expanding your belly and lower ribs. 3. As you slowly begin to exhale through your mouth, take one small, controlled step forward with your left foot, stepping through the doorway by about 6 to 12 inches. 4. Keep your torso completely vertical. Do not lean or bend forward at the waist. 5. As your body steps forward while your arm remains anchored behind, your shoulder blade, scapula, is manually glided backward and down along your rib cage, instantly opening your subacromial joint space and stretching the tight pectoralis minor muscle across your upper chest. Step 3. The isometric retraction hold, rhomboid re-innervation. 1. Hold this gentle forward-stepped position. You will feel a deep, satisfying opening stretch across the front of your chest and shoulder, with an immediate sensation of pressure lifting off your upper back. 2. Now, gently squeeze your right shoulder blade inward toward your spine, as if trying to hold a small pencil between your shoulder blades. 3. Hold this expanded posture for 5 full seconds, counting slowly in your mind. 1, 2, 3, 4, 5, 4. During these 5 seconds, your tight chest muscles are lengthened while your dormant upper back stabilizers, rhomboids and middle trapezius, are electrically re-innervated by your central nervous system. Step 4. The axial extension recenter, thoracic decompression. 1. Maintain your shoulder blade squeeze. Take a slow recovery breath through your nose and step your left foot backward, returning to your starting vertical stance inside the doorway. 2. Lower your right arm back down to your side over a 3-second count. 3. The moment your arm reaches your side, roll both shoulders gently backward and down twice. 4. You will feel an immediate profound sensation of lightness in your shoulder joint, an instant release of upper back tightness, and an automatic resetting of your upright posture. 5. Immediately repeat this exact sequence on the opposite side. Anchor your left forearm against the doorframe, step forward with your right foot, hold for 5 seconds and recenter. Perform 2 repetitions on each arm. Why is this simple 10-second doorframe habit so profoundly effective at eliminating shoulder pain and upper back tightness after age 70? Let us analyze the undeniable biomechanical physics taking place inside your body. When you anchor your forearm and step forward in step 1 and 2, you utilize body weight leverage to pull your forward-tilted shoulder blade back into its natural, anatomical position on your rib cage. This single movement instantly expands your subacromial space from 3 millimeters back to 8 millimeters. When you hold the posture in step 3, you eliminate friction on the supraspinatus tendon and allow oxygenated blood to flood your exhausted upper back muscles. Finally, when you recenter in step 4, your shoulder blade remains anchored in its proper location, allowing your arm to move freely through space without pinching soft tissue. In just 10 seconds, you transform a rigid, painful shoulder assembly into a smooth, fully lubricated mechanical marvel. Chapter 4. Clinical Dosage and Living Room Errors. To achieve permanent shoulder clearance, eliminate upper back pain, and maintain upright posture, you must execute this protocol with daily clinical discipline. Here is the biological adaptation timeline you will experience. Week 1. Subacromial decompression. Within your very first 3 days of practicing the doorframe reset, that sharp overhead catch in your shoulder will drop significantly. Reaching for kitchen shelves or dressing will feel remarkably smoother and pain-free. Month 1. Scapular remodeling. After 30 days of consistent daily execution, your tight chest fascia permanently lengthens, allowing your shoulder blades to rest in their natural backward position on your rib cage. Upper back muscle knots dissolve, eliminating chronic burning pain between your shoulder blades. Month 3. Rotator cuff restoration. After 90 continuous days, microvascular blood supply to your rotator cuff tendons is fully restored. Inflammation subsides, your thoracic spine regains natural extension, and you enjoy full, painless overhead arm mobility. 3 deadly everyday mistakes destroying senior shoulders. 1. Forcing overhead arm circles with slouched posture. Performing arm circles while your upper back is rounded forcefully grinds your arm bone against your acromion. Always open your chest and reset your spine before performing any arm movements. 2. Carrying heavy grocery bags with one arm. Carrying heavy loads on one side drags that shoulder blade forward and down, straining upper back muscles and crushing the joint space. Always divide weight evenly between both hands or use a rolling cart. 3. Sleeping on your side with arms tucked under your head. Sleeping with your shoulder jammed under your head compresses the rotator cuff blood vessels for hours, causing severe morning shoulder stiffness. Sleep on your back with a pillow under your knees, or place a pillow between your arms when side sleeping. Chapter 5. Reclaiming your mobility and sovereignty. Reaching your 70s, 80s, or 90s is an extraordinary milestone. It should be defined by personal freedom, wisdom, peace, and joy, not by physical restriction, shoulder pain, or the inability to raise your arms in your own home. Shoulder catches, frozen joints, and upper back pain are not inevitable consequences of getting older. They are simply biomechanical puzzles of forward-tilted shoulder blades, crushed joint spaces, and tight chest muscles. Today, you possess the exact clinical blueprint to solve that puzzle. The next time you walk past a doorway in your home, do not just walk through it. Take 10 seconds. Anchor your forearm. Step forward softly. Open your chest, glide your shoulder blades back, and restore your upper body sovereignty. If you found today's masterclass valuable, share it with your husband, your wife, your siblings, and your friends. Let us protect the physical independence of our seniors together. Thank you for your time and trust. Subscribe to our channel. Honor your physical temple. Practice your daily 10-second doorframe reset, and step forward into your day with absolute, magnificent power.